Hey, welcome back to the channel. If you have a tight lower back or tight hamstrings that seem really stubborn, or even a history of sciatica or piriformis issues, you don't want to miss this video because I'm going to teach you an exercise that could literally help you with those things, and it could help you very quickly. It's called spinal cord flossing. It's definitely unconventional and it is extremely powerful stuff. Let's dig in. Okay, you're going to begin seated and just pick whatever side you're going to work on. If you want to follow along with me, I'm going to be starting by working on my right side. So I'm simply just going to straighten out my right leg. Now, here's the idea behind this spinal cord flossing drill. This is going to be a mobilization for the tibial nerve. And what that means is we have to put our leg in a very specific position to increase tension on our tibial nerve. So here's how we do that. Once your leg is straight, you're going to lift your toes up as high as you can, and then you're going to lift your foot up as high as you can, and you're going to maintain those two positions. Now watch this really subtle part. I move my foot to the small toe side. Okay, so that motion came from my ankle, and I moved it out. Notice how when I did that, my hip did not rotate out. That is the common mistake, and that will decrease tension on this nerve. So make sure that when you move your foot out, your hip does not move. So now we have the position for the lower body. I do want to make sure my knee is gently locked out, and now from the hip, you're going to inwardly rotate. So without losing the position of my lower leg, I've rotated my hip in. Okay, and if you wanted to, you could just move your foot in towards your midline a little bit too. Okay, now the tibial nerve is under greater tension when your leg is in this position. And from here, I'm going to have you lengthen up. Now, some of you may already feel tension in the lower body, maybe through the calf region, maybe through the hamstring area. We want to keep that tension super gentle. This is one of the rules we follow when we perform what we call neuromechanics, which is the drill category that these spinal cord flossing exercises are within. We want to keep that intensity a 3 out of 10. That means you don't want it to be aggressive. Nerves do not want to be aggressively stretched. So if you feel this stretch starting to creep up, that's okay. Just make sure that we keep it pretty low grade the entire time. So now here's what we'll do. You're in the position, you're starting to get a little bit of a stretch sensation on the back of the leg. That's good, that means you're hitting the target. I want you to lengthen up, and now I want you to flex forward, and then watch this other movement. Laterally bend away from this target leg, and then come up. Now what you may have experienced, this is what I felt, is when I flexed, the tension increased a little bit, but when I laterally bent away, the tension increased quite a bit, and I actually felt more sensation go down the back of my leg into the calf muscle, okay? So what's happening there is we tension the tibial nerve, and then we're using the spinal cord as the driver, okay? This is an active mobilization, meaning we combine forward flexion and lateral flexion to be that driver. So every time I do that, I'm getting some movement, okay? I'm sensitizing that nerve even more. Now there's combinations here that you could explore. You could flex and bend with some rotation, okay? There's lots of different combinations here. I can even bend the other way and see how that affects me. Each person seems to be a little bit different in regard to which spinal movements increase the tension on the nerve. Most of the time, what you're going to find is what I'm showing you first, which is forward flexion and laterally bending away from the target side. That's usually the one that I think is highest payoff for most people, and it will increase tension on the nerve for most people. But sometimes as you're exploring it, you might find that you flex and then bend over here or rotate toward that target leg, and you might get some increases in tension. That's okay. So what I'm going to tell you is whichever combination of spinal movements actually increases the neural tension that you're feeling it is likely that those positions are going to be the high payoff positions that help you out the most. Okay, so that was the right leg. Let's go through it on the left in case you're following along here. To tension the left side here, again, toes up, foot out, rotate the hip in, move the leg in, lengthen up, and now I would flex forward. My tension is increasing, and because we're doing this on the left now, I'm going to bend away from the left. My tension increased even more, but I'm still around that 3 out of 10, so I'm safe. I don't want to bend to my right and then end up at a 7 or an 8, okay, because that's going to be too much tension. So if you're feeling a little bit too much tension, what you can do is just not go so deep into the position, okay, and that'll reduce tension, or you can kind of reduce the range of motion that you're using in the lower limb, and that will take some tension off the nerve. So with these kinds of spinal cord flossing drills, you really have to build them for the individual because each person feels a different intensity or different level of neural tension. So as long as you follow the rule of not going over a 3 out of 10 in terms of that stretch sensation that you're feeling, you'll be in good shape and you can do this safely. Now, last, make sure you retest some movement in how you're feeling. Don't just take my word for it, do the exercises and walk away and think you did something good for yourself. We actually want to know, was this the appropriate exercise to help you with your goals? So check some movement, right? Check some mobility, check some pain, right? And see whether or not the exercise had any effect on that. In many cases, especially if you have the low back issues I talked about, the sciatic issues, the piriformis issues, or the very stubbornly tight hamstrings, in many cases you'll find that this exercise can be extremely powerful for dismantling that tension. The only thing I'm going to leave you with in terms of a safety consideration is if you are somebody that tends to have kind of sciatic flare-ups, if you have a history of sciatica or some kind of flare-up from a cranky piriformis or something, just make sure that you are very cautious with putting tension on the tibial nerve. You would want to be very gentle because you don't want to overstretch it. And honestly, if you're in kind of an acute flare-up, this probably would not be the appropriate exercise to begin with. I have something different that I teach that you can find on the channel called tibial nerve slacking, which actually takes tension off of an already irritated nerve. So I hope you enjoyed this exercise. If you liked it, please give this video a thumbs up. That really helps out. And as you explore this, if you have any questions on how to do it or how to use it within your life, feel free to ask me within the comments. I'd love to help you out. That's it for today. I'll see you in the next video.